Hello, welcome to my video blog. This is my video blog for my upper limb and spine module. My rating number is 173738, and we're going to talk about a client that's 26-year-old. He's a male. He's right-handed, so he's dominant with his right side. He's complaining over a year ago about this injury, his shoulder injury. And the MOI, the mechanism of the injury, was he was riding a bike and then he fell over, overextended arm. So he started with that pain, acute pain. So he's a football player. He's an amateur player. He just carried on with that shoulder injury, but he didn't do any rehab sessions, or he didn't ask for any advice about it, because the sport that he was playing didn't need much attention on that shoulder. So he stopped playing amateur football, so he's now just working full-time. He just got a job in a bar in which he needs to do a lot of overhead movements. When he does his cocktails or shake the cocktails, or also the trays, which are quite heavy, if he has that shoulder flexed, it becomes quite painful. So today we're going to talk about the rehab sessions that we're going to do and the treatments that I chose. I chose some hands-on treatment, some soft tissue, and some rehab sessions. I think it's the best approach for this client. So first of all, what I can see from a posterior view, I just ask him to flex his elbows and abduct his shoulders at 90 degrees, just to see if the muscle bulk was different in between left and right. And we saw that the right side, which is the injured side, there was a decrease in muscle bulk compared to the left side, so there was quite a difference. I can show you a picture and we can see. Here we can see the difference where I'm going to point with the arrow. In muscle bulk, you can see that the traps, the biceps, and the deltoids are smaller on the right side compared to the left side, so there's an asymmetry there that we can observe, which was then demonstrated in the right arm on the resistant muscle test in external rotation, flexion, and abduction. So then we went for the range of motion test. We could see that he had 150 degrees of flexion and 180 on the left side, so there was 30 degrees missing in the right side. And also he was trying to flex his elbow, trying to compensate and reach a little bit more, so we knew that there was something that wasn't quite there. Then there was a lack a little bit in abduction, so there was pain when he was about in 160 degrees. He felt like something was painful inside his joint, and on the special test we went over the knees test, it was positive, and the scarf test, he was painful with his cross arm, and he felt quite tender and pain a little bit inside his joint, in the glenoid joint. So then we decided to just ask him if he had any like pins and needles or any numbness on the right arm or something like that, just to check if there was any tightness probably in the traps that's compressing any nerve that goes through the arm or something like that. But there wasn't, so I wasn't that concerned about any neurological problems on that right arm. So it was more something to do with the joint. And so this will be the rehab sessions and hands-on treatment that we have for him. So here what I started to do was some mobilizations to my client. I was doing a anterior posterior mobilization of the glenohumeral joint, in which there's been current studies done by Pecos Martin, in which he says that it helps to reduce pain, and also that feedback hands-on will help the client with the pain. Here what I'm doing is stretching the pec minor, so I'm applying an axial load directly onto the pec minor, and with my right arm I'm abducting his shoulder, so we could get that range of motion back. Here what I'm using is a deep tissue technique. Even there's many research on massage, there's no physiological markers that can are improved after massage, but it's more like a psychological effect that can do, and there's a slight improvement in range of motion, which we're looking for. Here we can see that I'm working directly over the deltoids. Here I'm working on the anterior deltoid, and we know that the deltoids originate on the distal third of the clavicle, and acromion process in the spine of the scapula, and this until the deltoid tuberosity of the humerus, so meaning that trying to give more range of motion with deep tissue massage can help in that motion of that arm. Here I'm just getting the lotion because I'm going to work on the back of the client, and I'm just focusing on working specifically more in the rhomboid area and the scapula, the muscles surrounding the traps. So I just want to warm up a little bit the area with some effleurage, bringing some blood flow to the area, and here you can see how I'm doing it from the erector spine and thoracic spine, where the thoracic spine starts, and then we go into the shoulder. So mostly what I'm willing to do is some deep tissue techniques. Over there we can see here I'm working on the rotator cuff, so that will be more infraspinatus until its attachment, and we will work also on the rhomboids after, so he gets back that thoracic rotation which we're looking for, and we'll see why after when we show the global screen. And also we will work on the supraspinatus, which gets really tight after and fatigued when you have a shoulder impingement, like a chronic one like he has. Here you can see I'm working on the supraspinatus. You can see here I'm always trying to, even though that I'm applying deep tissue, I'm always looking for any signs of the client that if it's too much pressure or not. I'm always trying to ask him. We can see here that he flinched a little bit, but we will readapt, and he was quite happy, and he said it felt quite good. Over here what we can see is that I'm trying to assist him on the flexion of his shoulder, so I'm applying a little bit of pressure on the HCG joint with my left hand, and I'm teaching him the movement that I want him to get used to, and don't be scared. We can see here how he can't completely flex his shoulder with the elbow extended, so he tries to flex his elbow just to try to reach more. Here we can see he can do a little bit better. I'm trying to assist him and get him used to that movement first of all. First thing I'm interested is just to get the range of motion back, completely get him comfortable doing that, and then we'll apply some load. Here we can see how I'm teaching my client on the global screen. On the lunge, we can see that he has a little bit of lack of flexion on the hip. Then when he goes back, we can see how his spine is quite flat, so the lumbar spine is quite flat and thoracic spine is quite restricted, which could lead into why is he not flexing properly on his right hand side. We can see that the right shoulder, when he goes up, wasn't completely flexed, didn't go over his ear. As shown here, we can see that the left arm is more flexed than the right one, and he's trying to do it more from the lumbar spine, extending the lumbar spine, and from the cervical spine. So we can see here how he's trying to do it more from there than from the actual arms. So in the rehab sessions, we will encourage our client to do more mobility drills on the lumbar spine and thoracic spine. Here we can see some exercises that we are teaching our client to do. So we want him to get used to that position where he has to work on the stability of the shoulders and doing those overhead movements to get him used to flex his shoulder with his elbows extended. Here we can see how we're slightly progressing it, and it's a little bit more challenging for him. So I'm trying to stabilize the bench so it doesn't slide, but we can see that how he can do it. We're trying him to keep his core still, his body, not move around the hips, just the shoulders, and engage all the body. So for this, we're doing around 10 reps for each arm, and we'll do it around 3 sets for the rehab session. Then we could progress it with more load or more difficulty or more speed. Here I'm training my client with a gym ball, so I'm asking him to flex his shoulder and apply force and abduction just to keep it. We can see that he dropped it here, just to have back that shoulder mobility control and gaining that proprioception. That will help him also with his job, which is carrying trays, and over a period of time he will get tired. This exercise is quite a progressive exercise. He was on his knees, but now he's standing up. He's flexing his shoulders. We saw on the global screen that he was doing the movement more from the lumbar spine, but here he's having control with it and working on serratus anterior and flexion of the shoulder, having that control back. We can still see here how his left shoulder flexes a little bit more, but he's getting used to the movement as part of the training. And for this, we will do around 8 reps and 3 sets, just getting used to it, and we will definitely be progressing in the next sessions. Here what I'm teaching my client is how to do external rotation movement on the shoulder. We can see how he improves during this video, his technique on the shoulder. I'm teaching him. I just want him to do like a slight isometric contraction for a couple of seconds and then control the tempo back, which there's no resistance, but I just want him to get used to that movement for the drills that are coming after. Here what I'm trying to teach my client is how to do external rotation with load. So he's lying on his side. I just want him to get the right position. I just want him to get his left hand under his right elbow and get more support, so his arm is straight. And here we can see how he's doing an external rotation. Just controlling the tempo will be really important, so we emphasize on eccentric loading, as there's some research saying that eccentric loading have great response with pain and on the rehab process if we know how to load it properly and progressively. This is also an exercise that he can do at home, and he could do it daily, so 10 to 20 reps while we progress it. So what we can see is that there's many benefits in eccentric loading, and it's just produced the efficacy is because of the high frequency and oscillations in tendon force that are produced by these eccentric contraction, which is an important stimulus for the remodeling of the tendon, and subsequently it will decompress more the shoulder impingement where we have the bursa and the tendons. For this exercise, we can see how this is a progression from the last exercise. I'm checking that my client has his shoulders abducted 90 degrees and he does proper good motion in his movement. You can see how tight he is just by using 1 kilo, but we'll see some progressions on it. Here we can see how we're working on proprioception and having control with that shoulder on the med ball. We're doing some internal and external rotations, still working on those rotator cuffs. Looks quite simple, but it's a med ball, 5 kilo med ball, and he says that he feels pain when he's going on internal rotation, so I'm asking him if we should stop. He says that it's not an aggravating pain, it's just like a 2 out of 10 on the VAS score, which is fine. But here I just stopped because we could regress it a little bit more and then we can go again with that weight. This exercise that I'm doing here is called Snow Angel. We progressed a little bit by adding weights. It's just 1 kilograms in each side. This will promote scapular stability, and we just want to train that upward rotation to avoid tipping and winking of the scapula, and then emphasizing recruitment of the rhomboids and lower trap to achieve proper downward rotation on the decent face. It can be very fatiguing and frustrating for my client, but also here we can see how I'm working on those retractor muscles of the scapula, so we can see that he's using his rhomboids to retract, so we're controlling the tempo. He's flexing his lumbar spine, but I'm just more emphasized on the upper back. There's a current study 2 years ago from Jeremy Fennell saying that shoulder retractors tempering exercise would minimize subacromial impingement, so it's related to my client's injury and will definitely help him to improve his posture. This is the same. This is a snow angel. This is quite regressed, so there's no weights. This is an exercise that he can do at home if he doesn't have any weights. It's still quite challenging, so it'll be more like an endurance. I'll probably ask him to do around 15 and then slightly progress and add in more reps and sets. Now I'll ask him to do 3 sets every day of this. It will be quite good and challenging for him at this stage. For the upcoming exercises, I want to teach my client how to do some retractions of the scapula and teach him the importance of it. Also, patient education is really important. So I'm explaining him that if he's really protracted person, he will have more difficulty to use his shoulder joints. So it'll be more difficult for him to make any overhead movements or abducted movements. Also, it can make it difficult to get blood flow and nerve transmission into the hands, so it could lead also into a neurological pathology like thoracic outlet syndrome or carpal tunnel syndrome in the worst cases. And in this exercises, I'm just progressing him, not only focusing in the shoulder ability to retract, but also to use the thoracic spine and use thoracic rotation a little bit more, so we can see on the decent face how the right shoulder blade is moving downwards, which is something that we're looking for in this exercise. Yeah, just correcting his posture there a little bit more, and we can do around 9-10 reps and 3 sets of this exercise. I'll be quite happy. This is definitely a home exercise that he could do whenever he needs to, and just grab a weight or anything that has any load that could. Well, just to conclude and to summarize a little bit everything of the treatment, he was feeling a lot better overall. So the outcome of this is that he, with a couple of sessions, he feels a lot stronger with his right arm. Just a couple of sessions, so he needs to keep doing those rehab sessions, or he can even do that at home or in a gym. He knows the exercises. Just have a little bit the knowledge of how to progress them or know when to progress them, and that hands-on treatment also will help a lot with the mobility of it, and hopefully he will be back to normal and have a normal life without pain on his shoulder. And that will be it for this video blog. Hope you enjoyed the rehab sessions and the hands-on treatment and everything.